Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and developer of the addiction-free pain management system. Today I want to talk about the role that stress plays in ineffective chronic pain management. A lot of people, when their stress levels go up, they start running into problems. One of the things I want to encourage people to do is learn how to identify what your levels of stress are. For example, on a stress thermometer, and I learned this from my colleague Terry Gorski, is if you're down at 1, 2, 3, that's the relaxation zone. Sometimes this is where I need to go when I'm meditating. You know, level 1 stress is when you first wake up, you're nearly asleep. Level 2 is you're starting to become aware and a little bit focused, but not totally. Level 3 I call vacation mode. I'm focused, but my focus is on relaxing. That's the relaxation zone. The next zone is the functional stress zone. Those are levels 4 and 5 are the optimal. At level 4, I become focused and active. At level 5, now I'm free-flowing and getting things done. Everything's happening without effort. Level 6 is starting to enter the danger zone for people living with chronic pain. Because when we reach level 6, you ever have one of those days you're having to push harder than ever? That's level 6. You're still getting things done, you're still focused, but it's taking a lot of effort. And that makes us very susceptible to pain flare-ups. Now level 7 starts the adaptation response or the stress reaction zone. At level 7 we go in and out of awareness, in and out of focus. We become spacey sometimes. This is also where the brain starts losing some of the frontal lobe capacity and going into the primitive brain, the limbic system, the amygdala limbic system, fight, flight, freeze, the survival brain. And when we get to level 8, now when I'm at level 8, I get irritated, agitated, driven, and defensive, and my body language changes, my tone of voice changes, and people looking at me can tell something's wrong with this picture. Level 9 is where I'm going to lose control and say or do something I'm going to regret, but I can't stop. Sometimes I call it the foot and mouth stage. And level 10 is meltdown. Now it's really important for me to practice some really good relaxation response tools. I just wanted to share a couple of those with you today. One of the ones that I teach my patients and I use myself is the combination of breathing and progressive muscle relaxation. So I have people take some slow, deep breaths, and then take a deep breath, and then clench their fists as hard as they can, just their fists. Take a deep breath and hold it as long as they can, and let it go. And then start doing that for the forearms, fists and forearms, then all the way up to the shoulders, then up to the head and neck, then the torso, and then pretty soon the whole body, but do it a muscle group at a time with the breath. Another one that I teach people to do is to count from 10 to 0 using the breath. For example, say to yourself, 10, take a deep breath and hold for a minute and then let it go. 9, take another deep breath, hold for a few counts. Let it go. 8. Until you get all the way down to 0. And use anything else. Some people will go for a walk, use some exercise. Some people will journal. There's a lot of different relaxation response tools, but it's important to practice those when you're in a good place. There's a strong correlation between levels of stress and levels of pain. There's a correlation. As our stress levels go up, our pain levels go up. As our pain levels go up, our stress levels go up. So the premise here is learn to bring your stress down, and immediately you'll start bringing your perception or levels of pain down also. So stress identification and management, I believe, is a very crucial part of chronic pain management and freedom from suffering. I believe that freedom from suffering is everyone's right, and it's also a responsibility. So be responsible. Practice some simple relaxation response tools today. Make a difference in your chronic pain management.